President Trump has made it a goal to stop the flow of fentanyl across the border.
While fentanyl-related deaths have decreased, there are still concerns for future funding in next year's budget bill. Tonight, we're listening to the voices of those on the front lines of the fentanyl fight right here in our community.
Fentanyl in the Kansas City metro, it's still a reality and a very real threat, which is why healthcare leaders and first responders met here at St. Luke's South Hospital to discuss and strategize. These are the faces of those who fight fentanyl abuse every day.
As a mother, I'm very worried about the youth and their exposure to these medications, and I want to help be part of that solution.
Jennifer Elliott works in the St. Luke's health system.
The biggest concerns I have as a healthcare provider is just resources for treatment of patients that maybe go down that slope into misuse of pain medication.
Congresswoman Sharice Davids says the efforts of these people are working.
It speaks volumes about the efforts of law enforcement, of our healthcare providers, of educators.
The amount of fentanyl deaths nationwide in 2024 has decreased by 24%. In Kansas, fentanyl deaths have decreased by 19%. KC Metro healthcare leaders say there's a big improvement in fentanyl overdoses in the schools because of more education and the availability of naloxone. KCKPD Chief Carl Oakman in attendance after getting back from the southern border.
We're losing Kansans to fentanyl poisoning, and this is really the first stop on really addressing that is here at the border.
We're seeing good outcomes, but there's still a lot of work to do.
While there's a decrease in deaths, Davids reports an increase of young children exposed to fentanyl.
They're seeing children as young as 2 or 9 months having exposure to fentanyl.
Davids believes the improved statistics are in danger. Aside from the big, beautiful bill, there's a proposed 35% cut in programs that fight fentanyl in next year's federal budget. She's a part of a bipartisan effort to keep funding where it is.
It would have a very detrimental impact on the ability for all of these folks to coordinate and continue to address the fentanyl crisis.
Knowing that we have this nice community of people working together to try to combat this problem is really important.
Megan Abundis, KSHB 41 News.
Megan, thank you. And you saw Representative Sharice Davids at that roundtable. Now she's headed back to Washington, D.C. to debate and vote on the so-called Big Beautiful Bill. Before she left, Megan asked for her thoughts on that legislation.
I have to see what the final product was that passed out of the Senate, but I can tell you every indication is that it's going to contain a lot of cuts to super important programs, whether it's nutrition assistance or Medicaid.